To start checking vital signs, you look at the overall appearance of the horse. Make sure they aren't visibly lame, they don't have gooey, crusty eyes, and they don't look upset or in pain. Next, you check mucous membranes. This can be found on the conjunctiva of the eye or on the gums of the horse. To check the mucous membranes, you gently lift the horse's upper lip and look at their gums. They should look pink and moist, as Dylan's are. If they are dry, the horse is dehydrated. If they are pale, the horse may be in shock. If they are fiery red, they may have a fever and infection. If they are purple or blue, there is lack of oxygen, and if it's yellow, they have jaundice. Next, you check capillary refill. You lift up the top lip of the horse, press your finger down on their gums, and remove your finger. Count for 2 seconds. If the color returns within 2 seconds, then your horse has good circulation. If color doesn't return in 2 seconds, the horse has poor circulation. Dylan has good circulation. The skin pinch is another good test to see if the horse is hydrated. You do it in front of the shoulder where there's extra skin. You pick up the skin and drop it. Count to 2 seconds. If the skin lays flat, the horse is hydrated. If the skin tense, the horse is dehydrated. If your horse is old, the skin will also tense because they have lost the elasticity of their skin. Dylan's skin goes down right away, so he is well hydrated. Next, I will find the pulse. I will find the maxillary artery under the jaw and have my handler time me for 15 seconds. I felt 8 beats, so 8 times 4 is 32, which is within the normal 32 to 44 beats per minute, so he is within the normal range. High pulse is also an indicator of pain and or recent exercise. Next, I will check for a digital pulse. You don't time it, you just see if it's bounding or not. If it's bounding, it means the horse has feet problems and there is pain. I didn't feel a digital pulse on Dylan, which means he has no pain in his feet. Next, I will take his heart rate. It is taken at the heart girth right behind the elbow. I will have my handler time me for 15 seconds while I count the beats. I counted 8 beats, and 8 times 4 is 32, which is the same as his pulse, and it also is within the normal 32 to 44 beats per minute parameters. After the heart rate, I'm taking the respiration rate, which can be taken by watching the flank area of the horse, and every time it goes up and down is 1 breath. I will have my timer time me for 15 seconds. I counted 4 breaths, and 4 times 4 is 16, which is within the normal 8 to 16 breaths per minute range. Next, I will check for gut sounds, which are found in the horse's 4 quadrants, upper and lower on both sides of the horse. Always check all 4 quadrants because 3 could be working perfectly, but the 4th may not, and would indicate colicking. If there's no sound, that means that there could be an impaction. If there are waterfall or pinging sound, that means that it could be hypermodal. We want constant gurgling, but not running or no noise. You may use ear or stethoscope as I do here. I found that Dylan has gut sounds in all 4 quadrants, which doesn't indicate any colic. Next, I will be taking Dylan's temperature with a mercury thermometer. Here I am shaking down the thermometer so the mercury goes below 98 degrees. Next, I will cover the thermometer with petroleum jelly using my finger. It is important to know the horse's temperature, as if it is high, it could indicate infection or fever. Sure, the horse knows that you are there as you approach him. Lift up the tail and insert the thermometer into his rectum. I will use the clip to clip it onto his tail so that the thermometer does not disappear into the horse. Wait 2 minutes with the mercury thermometer in the horse to check the temperature. The mercury thermometer is more accurate than the digital thermometer, which tends to run low. The mercury thermometer is farther into the horse, therefore can tell its internal temperature better. To remove the thermometer, I unclip it from his tail and gently remove it. I will clean it off using his tail, or you could use a towel, and then I will read it. His temperature is 99.5, which is between the normal 99.5 and 101.5 degrees. If you don't have access to a mercury thermometer, you can also use a digital thermometer. Just like the mercury thermometer, you cover it in petroleum jelly using your finger and gently move the horse's tail so you can insert the thermometer into their rectum. Turn it on and wait for it to beep. While you're taking the horse's temperature, make sure you are not standing right behind the horse, where you may be kicked. When the thermometer beeps, you can remove it from the horse, clean it with its tail or rag, and then read the thermometer. His temperature was 99.2, which is low, but that is because we are using a digital thermometer, which tend to run lower than mercury thermometers.